And beyond seniors care, in all aspects of our healthcare system, we need a strong public health response to be able to protect us from situations like we find ourselves in right now. So one of the strongest advocates we have here in Alberta for public health is Sandra Azakar, who's with the Friends of Medicare. Sandra, you're unmuted now.
Thank you so much. It's so great to be able to bring greetings of solidarity on behalf of Friends of Medicare. So great to see so many of you that I haven't been able to see for so long. It feels like a lifetime. I think, for Friends of Medicare, we have always done our advocacy through the lens and the underlying belief that working conditions are definitely care conditions when it comes to healthcare. And so for us, this pandemic has taught us a lot and has shone a light on the importance of our public healthcare system. Alberta is leading the way in testing, which serves to flatten the curve by having appropriate testing and diagnosis ahead of time, so that we can, get those people that need to be treated and isolated and so forth. But that only happens because we had a public laboratory that this government has and previous conservative governments have tried to privatize over and over again. So that's going to be one of the fights coming forward, is that this government has not made any kind of move towards reversing that privatization of our precision lab services. Even before this pandemic hit, they had changed the name from Public Labs to Precision Labs of Alberta. And so if you want to help us out, please sign a petition that we currently have going on our website. It's important that we get the conversation going about the importance and highlighting the role that our public labs have played throughout this pandemic, and making sure that this government rethinks their initial plan. We have also actually seen that healthcare definitely has models of care, but these models of care don't necessarily fit the vulnerable populations. So we see those homeless people, we see people who use drugs, people who do not, the most vulnerable actually, who do not at this point have the same access to the healthcare that people need. And I don't know if Marco has actually talked about, migrant workers as well, but that it's a concern when it comes to fitting the model of care that we have in this province. So there's a lot of lessons to be taken from this pandemic. But I was asked to really quickly, I'm not gonna labor the point that has already been made by quite a few speakers around the seniors care issue. Seniors, when systems are under stress, it's when we see the cracks. And the COVID-19 toll on Alberta continuing care system has exposed many of the cracks that have been created as a result of decades of privatization and the inequity that perpetual cost cutting has wrought onto the system. What we are seeing now was decades in the making, as Carol has pointed out. Seniors in continuing care facilities now count for over half of all COVID-19 deaths in Alberta. So that's 64 people out of the 92 that have died in Alberta are living in continuing care facilities. And now there's about 500 as of today, 580 people that have tested positive, and that number keeps on rising every single day. And as Sandy had mentioned, there is no clear data available as to how many workers who provide care to seniors or in other healthcare facilities have tested positive, because that's a huge issue that we need to have a better control of. So we have, as advocates and seniors advocates, we have been sounding the alarm over issues in seniors care system for decades now. We have repeatedly called on the government to get profits out of seniors care and to enact patient-staff ratios, and to address unsustainable workloads, which often lead to burnout for staff, and which degrade the quality of care and attentions that seniors deserve. you know, and we have right now a system where Alberta Health Services provides funding to seniors facility for staffing care workers, yet there's often no strings attached to this funding, and to ensure that 100% of it's spent on the staff that are providing care. And this lack of accountability and transparency are disastrous mismanagement of public dollars, and have resulted in what we're seeing today when it comes to the shortage of staff. The current funding structure that we have in that system creates the incentives for both the not-for-profit and the for-profit sector to pursue low-wage strategies of their staff, and where many are treated unequal in pay benefits and workplace rights in comparison to those with similar education and experience in working in public facilities right now. So that's a huge concern. So what has the response of this government and Alberta Health Services been through this pandemic? I think people have talked about, you know, the extra money that was allotted to private for-profit operators. $24.5 million was given to these for-profit operators to offset the cost pressures of COVID. Yet you'll be hard pressed to find any work site right now where that $2 top off just for the healthcare aides has actually been allotted to the frontline staff. It also served to create inequity and divide workers, because the only ones that were given this money were the healthcare aides, and it didn't count the LPNs or the RNs or anybody else who works in these sites that provide the same level of or that provide the care. So it's a huge issue for us. Following that up with protective equipment, you know, again, they had April the 10th that as a deadline for them to ensure that all facilities were providing protective equipment. Yet we know that there's some facilities where workers are only given 2 masks a day, and they go from room to room, and so there's tons of inconsistencies and a lack of standards when it comes to ensuring that workers are protected while doing their jobs, and at the same time they protect the patients that need to be protected. We have been calling for staffing ratios for decades now, and it has never been more important that that is somewhat facilitated now in legislation. There's currently a review on seniors care regulations that's being led by Rick McIver, and it has people like the owner of Rosedale on the panel, and so we need to make sure that coming out of this that we will be ready to fight to ensure that our seniors are receiving. This is the moment where returning to the same old is not going to cut it. When this pandemic is lifted and the brunt of the threat of the COVID-19 has passed, I think the toll that it has taken on our seniors should serve as a harrowing reminder of the failure of our seniors care system. And it will not be enough for us to return to normal, because in Alberta, our continuing care system's normal is woefully flawed. Once this pandemic is over, it is imperative that we do not return to the same old structure of continuing care that allows corporations and their shareholders to profit massively at the expense of Alberta's seniors. So we have the responsibility to do better. This crisis must serve as a grim yet timely reminder to our government that we need an immediate reevaluation of how we are providing care to seniors in this province. And first and foremost, this reevaluation must include bringing seniors care under our public umbrella, full stop. Thank you.
Thank you, Sandra. Yeah, profits before people before profits, and let the workers decide, because they're the ones that have the best interests of the residents at heart.